This segment is sponsored by GBMC Healthcare.
All right, since COVID-19 is still a new disease, much is still unknown about what causes the persistence of symptoms, what is delaying full recovery, or how to help those dubbed as long haulers. Although the vaccine is still the current focus, much is still unknown about the lingering effects of COVID-19. So joining us to talk about the patients known as long haulers is Dr. Theodore Bailey, Chief of GBMC's Division of Infectious Diseases. Hey, Dr. Bailey, how are you?
Hello.
All right, so talk to me. What are some of the symptoms of long haulers and the challenges of treating them, if it's lasting or lasting of COVID or something else?
Well, so what long haulers refers to are people that have had the COVID infection and who don't follow the typical pattern of resolution of symptoms within about 2 weeks' time. And in fact, some of the long haulers have still not recovered, so we don't really know what the outer limit of this is. It seems to be symptoms that are not part of an active infection, but some way in which the virus has left behind a form of injury to the patient, to the person. The symptoms that we see most often with long haulers, and I will say that long hauling is not common, would be symptoms of fatigue, chest tightness, shortness of breath. There can be some.
Okay. Now, Dr. Bailey, what are some treatments or how can you treat long haulers?
Well, because we're not entirely sure what's wrong with what the problem is, we're not sure how to treat it at this time. I would say that this is a frontier of active investigation, and it is something that has been a little bit more on the back burner because so much of the priority with research has been on helping people survive COVID. But we want people not just to survive COVID, but to recover from it. So this is an area of research that is underway, but I think has not been pressed as hardly or with as much urgency as has been finding things to keep people alive with COVID.
Oh, okay. So is it possible to be asymptomatic but have had a positive test and months later have had symptoms?
That seems to be much more rare. It would be difficult to pin that to COVID, I would say. Obviously, we can do the antibody testing and find that someone had a COVID infection, but these problems. So in someone who was never symptomatic, one of the things that we should automatically think about is what else could be causing this, and look for other sources of either autoimmune problems, rheumatological problems, things like lupus, things like rheumatoid arthritis, but also other infections that we typically deal with on a year-to-year basis, things like Lyme disease. So one should keep an open mind about what might be causing these symptoms in someone who sounds like a long hauler, because not all long hauling is long hauling. It may be other things as well.
Wow, lots of information there about long haulers. I had no idea about that. So thank you, Dr. Bailey, for joining us today.
Take care.